Okay, this is Sarah Hickey from Venus Concept, and we are delighted you are attending this webinar today. Our presenter, Renée Lapino, is a skin expert, a real guru, and truly passionate about Venus Viva. And in this webinar, we'll be talking about Venus Viva nanofractional resurfacing and also why she uses this device in her clinic. So over to you, Renée.
Thank you so much, Sarah. Hello, everyone. Thank you for joining today. I'm really excited to talk about the Viva and why I have chosen it for my clinic. Well, let's see, there we go. I'm having a little technical difficulty. Give me one. There we go. All right. So I am the I'm the head aesthetic practitioner and clinical owner in Notting Hill. So I have a little boutique clinic around the corner from Kensington Palace. I'm opening my second location in Belgravia as soon as we're all allowed out of the house. So my patients are really picky. They want results quickly and they don't want a lot of downtime. I have a very big reputation amongst the press, who gave me the nickname London Skin Guru, because I do look at the skin as a whole, and I don't approach the skin as only we're going to look at your scarring or we're going to look at your rosacea. I look at the skin as an entirety, so what's going on internally as well. And I've been with the press a lot for treatments with the Viva because I've designed a few different protocols that all revolve around that machine and that technology and that type of radio frequency. So Cosmopolitan interviewed me for like radio frequency, what I thought about radio frequency, and they were surprised, as most of the press were surprised, that it's not just simply monopolar, bipolar, unipolar, that you can do more with radio frequency than many people talk about. So that's where the fractionated radio frequency does come in. My treatments do vary from holistic facials, but we can easily add the Venus Viva into a holistic facial. So I'm going to talk more about that. And I'm very passionate about results-driven machines. So the Venus Viva is nanofractional radio frequency. We do use it for skin resurfacing, which of course can be scarring, enlarged pores, pigmentation, melasma, acne scarring, but I'm very passionate on using it alongside other protocols to get the best results. And the reason why I'm able to do that is because it is customizable. So you're able to adjust the ablation and the coagulation levels to treat a multitude of skin conditions. Because the technology is a smart scan, it's able to provide a greater depth of penetration. So you're able to work on things like deeper scarring or melasma, which we know is very surface, in one treatment, because you're able to adjust the smart scan and you're able to adjust the density. Obviously, because it is radio frequency, it's safe for all skin types. So you can treat your fairest rosacea Fitzpatrick 1, but you can also treat a Fitzpatrick 6 with acne scarring, which is so difficult to do with even a CO2 laser. Because it is radio frequency and the body is generating its own heat, there is a low downtime and the energy is delivered through the smaller footprint than a larger footprint such as Fraxel. And then of course, high patient satisfaction. I've never had a patient who was unhappy with it. Everyone who has it, who's had other fractionated resurfacing treatments, has been absolutely thrilled and talk about the lack of downtime and the comfort of the treatment as being phenomenal. Like I said, we can treat acne scarring and other scarring such as wounds. We can treat rosacea, we can treat the striae, which is usually going to be with stretch marks, but we can treat anywhere on the body with those stretch marks, even breast tissue, chest, obviously the trunk of the body, uneven skin texture, pigmentation. It's amazing with enlarged pores. I do a treatment with the enlarged pores where we do one full face resurfacing with the Viva, and then we go back 4 weeks later and treat only the T-zone, and then 4 weeks after that, we go in and we basically spot treat. So it's fantastic for pores. I have patients that swear to me they've tried everything for their pores. They've never seen a result. They sit up after one treatment and you literally see a difference after one treatment. Obviously, dyschromia, deep wrinkles, and rhytides and skin laxity, we all know that radio frequency is going to help with all of these indications. So the histological examination of the dermal collagen and elastin, the slide is here. We can see the thickening of the collagen bundles as well as the increase in the collagen content just by looking at the slide. So obviously we're seeing a big difference 4 weeks after 3 sessions. That's where this slide comes in, but you will see a difference on the surface. The patient will notice a difference as soon as 1 week post-treatment. They notice a plumpness to the tissue. They notice that their skin feels healthier as well as looks clearer. Obviously, it can be used in a variety of markets. So I love it for stretch marks because it is not painful. There isn't a lot of downtime. As we know, stretch marks don't have a lot of nerve response anyway, but when you're able to address and adjust the footprint of the energy to go right inside of that stria, they really don't feel anything, and it helps to break down that scar tissue and stimulate new healthy tissue immediately. 69% of women with stretch marks want to reduce them. So obviously when you tell a woman with stretch marks that you can treat her stretch marks with minimal downtime and minimal pain, there's a huge market there. And then consumers spend over 161 million per year in stretch mark treatment. In LA, they charge about 100,000 pounds for a full course of stretch mark treatment. So if you think about, well, $100,000 if you have a full course for your full body. So think about that kind of market. What you can do, you can easily do 1,000 pounds for 3 treatments for a full course anywhere in the UK. So it is a huge market. Acne scars, the US scar treatment market is worth 5 million, expected to rise by 10%. Acne scars in my own clinic is a large market. It's a large market in any age bracket. You have women that are coming in as they age, and because their collagen bundles are depleting, their acne scars are becoming more obvious. So they may not even have adult acne, but they're seeing adult acne scarring later in life. 6% of acne scar patients would trade a year off of their life for clear skin. That's a massive number. And as a previous acne sufferer, it's completely true. Acne scarring massively impacts people's lives and really harms their self-esteem and how they view themselves. And then rosacea, over 16 million people in the US seek regular treatment for rosacea. As we know, rosacea is really difficult to treat. It's not one of those that you can just throw a standardized protocol at it and see a major difference. 75% of those patients report low self-esteem due to the condition. So being able to treat stretch marks, acne scars, and rosacea, not to mention skin laxity, all with one treatment, one machine, massively increases your treatment offering for your clinic. So skin resurfacing technologies, we've seen multiple different technologies for resurfacing out there. We've all worked with them. The ablative resurfacing, the CO2, obviously we basically break down the surface of the skin in its entirety and allow it to heal. Superficial, we break down the epidermis, stay above the dermal epidermal junction, and we get some superficial healing, a little bit of a boost in the collagen. Non-ablative fractional resurfacing, the energy penetrates, but you don't get as big of a boost in the collagen either because it doesn't spread throughout the tissue. With the ablative fractional resurfacing, you break down the tissue and then the body fills it back in. So you have all of these different technologies that you can bundle together because we have ablative fractional resurfacing and non-ablative fractional resurfacing together. So the fractional ablative RF works in the epidermis, the dermis, and the dermal epidermal junction. So we're able to work past the sensory nerve endings down into where you have the dermal epidermal junction and the new tissue. That's we're stimulating where the new tissue comes from. So in that way, we're able to break down the damaged tissue, the scar tissue, the tissue that's unhealthy, where you're having instances of rosacea and even eczema, and stimulate new healthy tissue to take its place. So the current flows through the tissue down into the actual healthy skin. And that's going to help to coagulate your new tissue as it's stimulated by the ablation. So the energy is going to flow between the pins, if that makes sense. While all 4 pins are active, the other pins are all receiving energy. So you're stimulating the tissue with the energy through the pins, and that's going to ablate the epidermis. But then the dermis is going to begin to coagulate, which is going to stimulate new healthy collagen. So that tissue that's ablated is going to be fulfilled with stimulated healthy tissue. So you can see that's kind of a slide of what the energy down into the tissue looks like. So you can see we are passing through the dermis, through the epidermis, and through into the dermal epidermal junction. So the goal is to create these tiny little wounds in the skin. And on the surface of the skin, if you look in a magnifying glass, and I always tell patients not to, because if you look in a magnifying glass for about 48 hours after the treatment, it almost looks like you're covered with tiny little blackheads. It's not blackheads at all, it's these micro wounds. So the micro wounds in the skin activate that natural wound healing process. And when you can explain that to a patient that we're causing these little teeny tiny microscopic channels that cause the body to stimulate all new healthy collagen, as well as break down the scar tissue, break down damaged tissue, break down pigmentation damage, that enables them to wrap their mind around it and also enables you to give a more effective treatment. So you're going to cause that intact skin to serve as a reservoir for the fibroblasts. So by creating these little tiny micro wounds, the intact tissue surrounding the micro wound will cause the micro wound to heal faster and generate new healthy tissue faster. So it's going to help to stimulate that new tissue in the areas where the micro wounds are sitting, which will cause the collagen remodeling and the neocollagenesis. So here, this fancy slide is basically just explaining that we have the fractional thermal injury. That's what happens instantaneously. And then you have the vaporization of the epidermis. So you're going to actually, it smells kind of like a burnt popcorn type of a smell. You can actually smell the dead skin cells vaporizing off of the skin. I always warn my patients, they always find it quite amusing or funny because they can actually experience that. It's not just, I'm not just feeling a warm tingle, I'm also smelling something's happening. That's the micro wounds in the skin surface, is the delayed impact, and the collagen denaturization. Then obviously you're going to have little minuscule scabs form, which is your healing response. And then of course we know that the inflammation causes the fibroblast stimulation and causes the new healthy tissue to regenerate, reorganize the collagen, and fill in the ablated area with new healthy tissue minus the scar damage. Like I said, the energy is colorblind, so you have a lower risk of post-inflammatory hyperpigmentation. I personally, because we know that the radio frequency is stimulating the patient's own energy response, I personally find that Fitzpatrick's 3 and 4 get the best results as far as minimal downtime and increased visualization of the effects after the treatment. So if Fitzpatrick 3 or 4, I will tell them within 6 to 12 hours, they're going to feel like they've already noticed a difference in their skin. And they do. They will text us. They'll call the clinic. They'll go out to dinner. I have good patients that have been having Viva for quite a while, and they'll schedule to have a Viva when their family's coming in town that evening, come in at 10 in the morning and then go out for dinner because they feel like it makes their skin just glow instantly. They start to get a healthy glow straight away. So it is colorblind, and you can treat all skin types with a great result. You have more coagulation in the tissue surrounding ablative zones because you are stimulating that energy response. You have lower downtime because it is, again, your body's own energy that's responding. And then because of this, it's a much higher safety profile with a lower risk of complications. I don't worry. When I send patients out, I tell them the only thing they could do is go sit in the sun or go put something on their skin that they're not allowed to. So we simply tell them what they're allowed to use for 48 to 72 hours, depending on how deep of energy we've used, and to stay out of the sun and keep their SPF on. But you don't have to worry about them going away and having a late heat response like you would with some of your other ablative energies. So it is much safer. You can feel much more confident because it creates the ablation of the skin in a fractional manner. You do have that minimal downtime. Minimal downtime is, of course, due to the faster wound healing. You may feel like your patients they'll almost have a little bit of heat after the treatment. They'll feel fine, and then a few hours later, they'll feel a little bit of heat. It's simply the body beginning to stimulate new healthy blood flow into the area, and that's about it as far as a response later on down the road. The Smart Scan technology does allow for the different ablation patterns, and the reason why that gives you greater control is because let's say you are working into the T-zone, and a lot of people will have quite heavy scarring around their nose or in their chin, but you aren't wanting to treat out further into the cheek. You're only wanting to stay into one minimal area. You're able to adjust the footprint of the tip to only treat heavily in other areas. So you can take half the tip and turn it on and turn the other half off. You can set half of the pins to fire and set the other half off, which I'll go into more. It's the only system, though, that does this, which features the variable ablation and the coagulation ratio control. So you're able to get predictable results. There's no risk here where you're worried about, oh, I went a little bit heavier, I did a second pass here, and I treated healthy tissue and scarred tissue at the same level. Is the healthy tissue going to be okay? You're able to adjust the handpiece to treat the tissue equally in the way that you want to. The tip is patented. It is, I love these tips. They're very, very easy to treat with. They simply click on and you have 700 shots per tip. If you just do one pass on the face, it's about 285 to 300. So you're able to do 2 complete passes and then go in and do a third pass anywhere that you may need it. Or you can do a whole face and neck and do a second pass where needed. So it really gives you the ability to treat personally to the patient, to make a bespoke treatment with this resurfacing. The depth of penetration, obviously you've got the large coverage area for faster treatment. So that tip is, that's about the same screen size, that footprint is about that size. So it takes, if you're just doing one pass on the face, about 12 to 15 minutes if you are working into the moderate settings, which obviously when you have a longer set, when you have a deeper setting, it does pulse for a little bit longer. So there aren't any return electrodes, and even energy delivers to each pin. You have the high energy density in each pin tip, which gives you the greater depth of penetration, and then it's delivered to the pin groups in randomized manner. So your body, the patient's body or the patient's face isn't feeling like it's repetitive. The energy is not continuing to zap them like an IPL or like a Fraxel. It's delivering in a randomized manner, which makes the treatment much more comfortable. Those pins that you see on the screen look a little bit scary in the slide. They don't penetrate the skin in any way. They simply rest against the skin. It just feels almost like a Lego sitting against the skin. You can feel it. You can feel that it's firmly against the skin, but it's not going to puncture the skin or wound the skin in any way. That high energy density enables the appropriate contact with the skin. So it allows the pin to sink into the skin's tissue without it being uncomfortable. So as I said before, it's like a Lego. If you see the drawing to the left with the red outline, that's how the tip sits against the skin. So it's able to, you're able to work into areas where you have peaks and valleys of scarring. You're able to treat in and get the ablative energy down into that more damaged tissue because of the morphology of the tip, because of the way the tip sits against the tissue. So we know with wounds, which wound will heal faster, a long and narrow cut in the skin or around an asymmetrical cut in the skin. So when you're working on wound healing with the Viva, which one is going to heal faster? So we know that the small round line is what's going to heal faster. And we know that this smart scan technology on this screen is what allows that to heal faster. So it allows variable energy densities in a single tip. So it enables the ablation and the coagulation of the epidermis and the dermis node in a fractional manner. So this is going to enable you to break down that damaged tissue, as I've said, stimulate new healthy tissue, and you're going to see a lower risk of post-inflammatory hyperpigmentation because of that. So I have patients that come in with melasma, and this is huge for me, and I rely heavily on the Viva for melasma treatments. It's the only machine that we use in melasma. And obviously we're going to put them on skincare, home care, sometimes retinols, always on a melanocyte inhibitor. But with the nanofractional RF, with the Viva, we're going to treat very shallow. And then in the areas where they don't have any pigmentation, we may go a little bit deeper. But we know that melasma relies on the surface of the skin, and we aren't trying to create deep wounds. We're just wanting to create very surface wounds that boosts that cellular turnover, ablades the unhealthy tissue with the excess pigmentation, and enables the new products that we've introduced to the patient's skin to get to work and work alongside this smart skin technology. And because the variables of the tip are there, we're able to modify the treatment to ensure that we are treating the areas with pigmentation and the areas without pigmentation differently to ensure an outcome that's best for the entire skin surface. The importance of that ablation and coagulation control, again, it gives you the ability to treat multiple areas with a lower risk of PIH. And then, of course, the longer pulses resulting in an increased coagulation effect allows you to treat tissue that's more damaged. When you have boxcar and ice pick scarring, you want to get into the inside of that scar where the tissue isn't as damaged. You may want to work on the outside of the scar where you have a thickening of the tissue. You're able to modify the treatment to do so. The results, therefore, are not going to be patient dependent. You aren't simply doing a CO2 and slicking all of the tissue away. You're working with the tissue and setting the handpiece, the treatment up to do so accordingly. So you have full control of patient comfort as well. You can numb with this treatment. You can use the topical numbing. We probably in my clinic only use topical numbing if we are treating at 40% or above, which on the screen it shows you what percentage you're treating at. But initial onset treatments, melasma, rosacea, anti-aging treatments, you do not need numbing whatsoever. When you're working on heavier scarring and you're wanting to treat deeper into the scar tissue, a topical numbing can make the patient more comfortable. But again, it depends on the patient's tissue, the patient's pain tolerance, and also the patient's relationship with their skin. If they're scared, if they're nervous, I like to numb them because I find that they feel more pain than patients who are more confident. So they may start out needing numbing at the first treatment, and by the second or third treatment, they don't need any numbing, or they need drastically less numbing, less times numb, because they're much more confident in what's going to happen. So you have the treatment parameters for those different skin conditions, so you're able to determine what areas you want to treat in which way, because no patient has a full face of scarring or a full face of melasma or a full face of enlarged pores. So with the Viva, you're able to modify what you're treating and modify how you're treating it. So that makes this treatment able to be completely bespoke. Whereas with things like, I used to do a lot of Fraxel in the US, and with things like the Fraxel, you can't simply sit and modify the depth for a certain pore and then lengthen the wavelength for another area. It's much more difficult. With this one, it's just quick tip the button, quick tap of the tip, and you're able to completely change the levels that you're treating in an area that's less than a millimeter away. So obviously this shows you what the skin pattern looks like on the surface. Like I said before, if you tell the patient, now that's with one pass, but if the patient walks out and then gets in a magnifying mirror that night, they will say, oh, it looks like I'm covered in blackheads. Those are simply the micro wounds. So you can see what it looks like inside of the tissue to the left. You can see what it looks like on the surface of the tissue, bottom left, and then you can see what it looks like internally with the 464 microns. And that's at 280 volts with 28 milliseconds. That isn't 100% of energy output. At 100% of energy output, I've completely remodeled patients' skins that have heavy boxcar and ice pick and rolling scarring. It is amazing. And you see a huge difference with the 100% with just one treatment. It is very similar to a high level laser. So the fact that you have less risk and the fact that you have less downtime enables you to treat those darker Fitzpatricks, or patients who may have systemic issues, patients who may have autoimmune issues that you're worried about treating with a laser. It gives you the ability to treat those same hardcore skin problems and challenges with a device while minimizing the risk to yourself, as well as to the patient, as well as to your insurance. So you always need to perform a test pop. You want to make sure that your patient is comfortable. You want to let them know how it feels. I always explain to them they're going to feel a hot tingle. Initially, it won't feel like much, but over a few minutes, it may feel more warm. I have handheld fans that we especially use during the summertime, but it just depends on your patient and your clinic. I don't have my rooms air conditioned because I find it can be quite uncomfortable to have the air conditioner blowing in your head if you're having a more traditional treatment. So I do like to use the handheld fans, but you just perform a test spot all the time to give them an idea of what it feels like. You don't need to push against the skin. This isn't a multipolar body treatment. You're simply resting the handpiece against the skin, make sure the tip has full contact, and then you pull the trigger once and allow the patient to feel it. You always start with low parameters. You want to make sure that their skin's responding the way that you want it to, and you also want to boost the collagen response. You want to let the body know what's happening and allow the body to feel safe. You don't want to trigger that fight or flight straight away in the first treatment. Then you'll increase the energy from one treatment to the next as long as the patient feels comfortable to improve the results, except for in the instances of rosacea and melasma. With both rosacea and melasma, I treat at the lowest level possible for 3 treatments. And then if we're looking into more resurfacing work as far as texture of the skin, anti-aging, lifting the laxity of the skin, then we'll move into those areas at a deeper setting. But those first 3 treatments, because I am wanting to treat a condition that's in the surface of the skin, I like to stay shallow, keep the energy low. It is recommended, again, to use topical anesthesia to avoid patient discomfort, but like I said, at those initial settings, the 11, 15, 20, 30%, it is not necessary at all, but it's best to perform the test spot to allow the patient to identify that for you. Because if it's a brand new patient, you don't know their pain tolerance, and you do want to make sure they're comfortable, and you don't want them to have an unenjoyable experience and therefore not want to have further treatment. The skin must always be completely dry prior to the treatment. Humid skin will impair ablation because this is radio frequency, so you don't want any water or products on the surface of the skin. 3 to 5 treatment sessions are recommended. In my clinic, when we start a course, I always tell patients every single treatment will make a difference. We always recommend a minimum of 3 treatments to start. At the end of those 3 treatments, we're going to reassess your skin, discuss the results, discuss your skin goals, and then we'll decide if we want to continue with more of the Viva or if the Viva has basically given us the goal that we were looking for, and if there's another treatment we may want to add in. So 3 to 5 are recommended in a course. However, every single result that you get obviously is permanent because you're stimulating new healthy collagen to develop, but I tell my patients they are going to want to maintain their results because they are going to continue to age. So I recommend a maintenance treatment every 3 to 6 months. And that's for my patients that are in their 40s. For my patients who are under the age of 40, I tell them every 6 to 12 months. And it's not a big deal. It's an easy, quick treatment. There's not a lot of downtime, so patients are thrilled to have it. These are simply the parameters and recommendations for your treatments. So you can see 7 to 9 milliseconds, 240 to 270, that's going to be a shorter treatment. Then with the Straya, obviously 12 to 15 milliseconds with the lower voltage. With wrinkles and fine lines, you stay at a low voltage with a higher millisecond. So you're going to treat about the same amount of time, but it's just going to depend on, look at the numbers. Your voltage is your ablation and your millisecond is your coagulation. So we know acne scars, that makes sense because 270 voltage, that's high ablation. We're trying to eradicate the acne scar, and then we can worry about stimulating more healthy collagen production for wrinkles and fine lines later on down the road. So it simply depends on, does your patient have 1 parameter? Do they have 6 indications? What are you trying to treat? If this patient were 45 with the acne scars, I would do 2 to 3 treatments at 240 to 270. And then after we've seen a massive decrease in the scarring, then I would bump up the milliseconds to give me more coagulation. But because I've already treated her at 240 to 270, I would keep her at 240 to keep that high ablation and continue to work on the acne scar. But now I'm wanting to coagulate further and stimulate more healthy collagen and more healthy collagenesis. Immediately post the treatment on a low setting. So this would be, let's click back really quickly. So low, medium, high. Acne scarring would be high. Enlarged pores would be medium, wrinkles and fine lines would be low. Okay, so on low, wrinkles and fine lines, they're walking out with a minimal grid pattern. Medium, a higher good pattern, and high, like I said, that's when they think they're covered in blackheads, because you can see quite a heavy, almost like a minimal micro pore burn pattern. And that lasts for about 12 to 48 hours, depending on the patient. On day 3, the skin starts to shed, and I tell them it's micro peeling. You can't see it with the naked eye, but when you touch your skin, it feels like sandpaper. The diamond polar applicator works well alongside the Viva because you can carry out the treatment beforehand. You can also carry out the treatment afterwards in a separate session. So you could have the patient come in and carry out a diamond polar treatment to tighten the skin, lift the skin if you are dealing with anti-aging and acne scarring, and then carry out the Viva on top. You could then have them come in, because we want to leave 3 to 4 weeks in between treatments. So you could have them come in every week following their Viva appointment, and further boost the collagen and elastin for the patient's jawline. But basically, it's also going to help to heal in the results from their fractionated treatment. So we know that the diamond polar is non-invasive wrinkle reduction and skin tightening. It's the multipolar technology without downtime, safe for all skin types. Not only is it pain-free, it's enjoyable, but it's also bundled with pulsed electromagnetic fields. So I'm obsessed with this handpiece because of the pulsed electromagnetic fields. Pulsed electromagnetic fields help to heal bruising and swelling. So it is a magnetic field that allows the magnets to work with each other to stimulate new healthy blood flow and healthy cellular regeneration. So it triggers something called FGF2 that stimulates fibroblast production. So that new fibroblast proliferation has increased collagen synthesis. And then we promote angiogenesis to stimulate the nutrient needs of the tissue, which is going to give you new healthy blood vessels. So you're basically reconstructing the skin matrix with fibroblasts, but you're stimulating new healthy tissue to come in, stimulating lymphatic drainage to move the cellular debris away. I'm looking for a slide, which is about to come up, that I really want to show you because it's my favorite slide, but it's basically the effects of the magnetic energy on transferred vessels. So there was a study, and they took basically a control group of rats. None of the rats were harmed, but they took a vein and removed it from the tissue and sewed it onto the surface of the skin. For the control group, they didn't have treatment at all, and for the treated group, they had 8 weeks of 30 minutes of PEMF. So you can see the skin actually grew a whole new layer of tissue with new blood vessels up to the vessel, and it almost absorbs that new vessel with new tissue. And that's what PEMF does, which is what makes that multipolar so powerful, because you'll be stimulating new healthy blood flow into the tissue. So you can see, I mean, obviously it works beautifully by itself, but when you use it alongside the Viva, it makes the Viva even more powerful. So when you use it alongside the fractionated radio frequency, to clarify, it's going to make the results much more powerful, because you've stimulated the angiogenesis and you've stimulated the collagenesis, and now you're continuing to feed it and to stimulate even more while you're waiting for that time frame to pass for the tissue to fully heal from resurfacing and then have another resurfacing treatment. So together, obviously, they combine to the pinnacle of treatments. This is the Venus Viva on Straya. So the before and after of one treatment, you can see the stretch marks have healed significantly, and she's pointing to one remaining deeper stretch mark, but those are few and far between. There we have it on the legs. So again, that's only after one treatment. So there's a huge difference from each one. On the face after one treatment, this is the rosacea treatment, obviously. So you can see the lesions have drastically reduced. The pore size has drastically reduced, but the skin appears smoother and less even as well. On this patient, this is after 3 treatments. Not only is her laxity greatly improved, her rhytides greatly improved, you can also see the pigmentation is much smoother, and the pore size is not even noticeable at all. She looks almost photoshopped from one to the other, and it's simply 3 treatments. After 3 treatments on this lovely lady, We saw a huge decrease in the rhytides and wrinkles, and we saw a beautiful decrease in the pigmentation as well. But then again, her jawline is so drastically lifted, and those 3 treatments would have been carried out at about 4 weeks apart. This gentleman had boxcar and ice pick scarring combined. 3 treatments here has smoothed the skin significantly. For him, I think 6 would have him almost perfect. And this gentleman, acne scarring and active acne. So 4 treatments have helped to heal the pigmentation, heal the lesions, completely reduce the pigmented scarring, and then of course healed the parameter of the scar as well. Rhytides and wrinkles, as well as laxity and stretch marks. Pigmentation, scarring, pores, massive scarring, massive pigmentation. This patient, it's hard to see in this picture. She's really textured and her pigmentation is not nice. And she has a lot of active breakouts, whereas in the after treatment, there's no active breakouts. It's much smoother. The pigmentation is gone. Same with this patient. Now this lady, I love this because you can see this would have been very loose, and which you can't experience in a picture, that you can experience in real life, is this tissue is going to be much firmer now. It's going to have that spongy, youthful feeling, whereas this tissue here is just going to feel kind of dead, just like skin. Whereas now, look how drastically her neck is improved. Her neck looks about 15 years younger. But this tissue along here is going to feel much more firm, spongy, plump, healthy. So we've completely given this woman a new jawline and a new neck. For scarring, it's great to get in immediately after surgical stitches, or if you have some sort of accident after the stitches come out, you can see she has a little bit of pigmentation. All she needs now is time, and the pigmentation will help to heal and she'll have no scar. I wanted to go ahead and ask if you guys have any questions about how I combine it with other treatments or anything about the Viva in particular.
Actually, Renee, we do have a couple of questions. So
Yeah.
Michelle wanted to ask, in terms of the stretch marks, with the older silvery type of stretch marks, how successful it is on those as well as the kind of fresher red ones?
It is really successful on the older ones. As a matter of fact, we usually only treat the older ones. Obviously, I love to treat the fresh pink ones, but I don't see as many of those in the clinic. So I've primarily used it on the silvery ones, and it's fantastic. You do want to go a little bit deeper initially, because if you use your brain, it makes sense that you want to ablate that tissue. So you want to bump up the ablation to break down that damaged scarring. And then, of course, it takes about maybe 6 treatments to eradicate them as much as you can.
Okay, and then Eliav's asking, when you're using both applicators, which one would you use first?
Always use the multipolar first, because the multipolar, you have the gel. You don't want to put any sort of product on the skin after the Viva, because you do have the micro wounds and you don't want to put anything on top of those wounds. So you can combine the nanofractional with other modalities as well. Like if you want to do a mini peel before you do the Viva, that's fine. But you always want to use anything else. Anything that you're going to add to the fractionated technology, you want to use that first and make sure that those micro wounds are always the last step of the treatment.
Okay, and then Leandy's asking, what would you do if you were treating around active acne? What way would you treat it with active acne? Okay,
so if somebody has really active acne, we will treat and do 1 to 2 passes around the lesions, and then we'll go in and with the last pass, we'll treat over the active lesion. So that way you're not treating the active lesion and spreading it around the face. You are basically just correcting the active lesion, because it does eradicate the activity and it does help to heal any sort of infection, but do that last. And if somebody has very like I mean, I don't want to be gross, but if somebody has really infected, like pussy acne, where it's just oozy, you can go over it lightly, but then we simply spray it with Clinicept. We spray the tip with Clinicept and dry it off if we're going to need to add anything else on top of any other active acne lesions.
Okay. And then we've got Dr. Desi. Do you ever combine the Viva treatments as part of a facial type treatment? So do you do any, I suppose, nanofractional with other types of treatments that you do?
So we combine the Viva with skin pen as well as IPL, as well as high
Yeah.
through heels. But do you mean other ablative technologies or just other technologies full stop?
I think just in terms of other tech, well, we can talk a little about the Tribella treatment. So the Tribella treatment is a triple modality treatment which embraces the two applications that Renee's spoken about today, but it also includes the IPL at the start for treating color irregularities. So that's how that would work with that one.
Right, which is beautiful. That's one of my favorite treatments. And then, of course, line it in like we do a mini facial every treatment. So we don't have them come in and cleanse their face and just do the Vivo. We have them come in, we do a cleanse, we do an enzyme peel. Then if they need any sort of IPL for pigmentation, or if we are going to treat with radio frequency, or if they have really a deep, deep scar that we want to treat deeper than the Viva can allow, then we would work on all of that alongside the Viva. So it doesn't make any of your other modalities obsolete. It simply adds to everything else that you already have.
Okay. And then Roy is asking, when will the patient see the results after the treatment? How long would you expect it to be that the client would start to see their results from the nanofractional?
Okay, so what I tell patients all the time, they actually joke about it. I tell them in 1 week, other people will start to say, you look nice. And in 2 weeks, you'll start to look in the mirror and feel like your skin looks amazing. And at 4 weeks, you'll be living your best skin life. So 1 week, other people really notice. At 2 weeks is when you feel like, oh my gosh, but you do continue to get results up to 4 to 6 weeks.
Okay. And then I think we covered Dr. Desi's, that's fine. And then is it normal for people to present with some swelling around? You know, would it be typical for people to experience swelling with this area 1 to 2 days post?
Some patients can experience swelling afterwards. I wouldn't say it was normal, but it also depends on how deep you're treating. So common sense, we know if we're coagulating at a higher level or ablating at a higher level, there's going to be a lot of activity in the tissue. So some people can respond to that with some swelling even 2 to 3 days afterwards. We usually will tell them to take an antihistamine or a Nurofen if they're worried about it. If they're not worried about it, there's no reason why they would need to treat it. It's
Okay.
simply the body stimulating new healthy tissue and new healthy blood flow.
Okay. And then Thies is asking, would you suggest with patients with sensitive skin to start with maybe the diamond polar to build the strength before doing the nanofractional, or would you go right in?
It depends on, like if it was a rosacea skin type, I probably would do 1 or 2 diamond polar sessions first, depending on how severe their rosacea was. If it was like even level 2 or 3, I would definitely say yes, treat them with the diamond polar so that their skin's a little more resilient, and that way it's also not as uncomfortable.
Okay. And Leandi's asking, she's seen that maybe some practitioners use sheet masks directly after the nanofractional. Is that okay, or rather not? What would you do?
Okay, so I know like Venus, we're not supposed to use anything after, but in my clinic, I like to use a biocellulose sheet mask or LED afterwards. So it
Yeah.
simply depends on if the patient has really dry skin, I might use a biocellulose mask, but obviously not one with active ingredients. You just want something cold and wet, maybe with like some collagen, and always do a patch test beforehand.
Okay. And then Roy's asking, do you recommend a demo treatment and how? I'm not 100% sure. Maybe Roy, if you could just confirm a little bit more about that question, if that would be okay. And then Sally is asking, what products do you recommend patients to stop or incorporate into their routine when they start with Venus Viva? So it's what they need to stop or what they need to incorporate when they start with the nanofractional.
They don't need to stop anything. I don't pull my patients off of retinols beforehand, but after treatment, I don't want them on any actives or any retinols for a week afterwards, simply because I don't want them to cause any irritation to themselves, or you don't know where they've gotten their products either. So most of my patients will be good and only use cosmeceuticals, but occasionally you'll have someone who wants to put straight tea tree oil on their face or something like that. So I won't have them stop anything beforehand, but afterwards I'll have them only use a gentle cleanser and then a cream that won't inhibit barrier function. So like the Aven Cyclophyte, I love for them to use afterwards for a week. And normally, unless they have an acid cleanser or an exfoliating cleanser, their cleanser will be fine. If they're on an aggressive active cleanser, I'll have them simply use an oil cleanser or a cream cleanser for a week following.
Okay, and I think you covered it in some of that, but I think Emma from Airbrush is saying, could you talk us through your recommendations for home care post-treatment? So, you know, what they need to do straight away.
Yeah, what they need to do straight away is simply use a gentle cleanser and then a gentle cream without any actives that supports the barrier function of the skin. Or they could also, if they don't want to use a cream, they could also use an oil that's full of nice, healthy fats to help the skin to regenerate. And then usually if they are doing resurfacing treatments, now not for rosacea, but for all other skin types, I'll have them use a retinol cream, but a gentle retinol, but not start that until a week after their treatment has concluded. So if they've had treatment on Monday, then the following Monday, they can start their retinol in the evening.
Okay, so nothing for 24 hours though. That's the first and main thing is what we normally say a little.
Yeah, nothing for 24 hours unless if they've had their treatment in the morning, I will tell them in 12 hours they can apply whatever cream or oil I've recommended.
Okay.
Because they may feel a little bit tight before they go to bed and you don't want that to prohibit them from sleeping.
No. Okay. And then we've got Leandy on from South Africa. Would you recommend a treatment setting a little bit lower for places like South Africa, especially in the summer?
Yes. Yeah. I mean, you don't want to send them out with any sort of swelling. So when it's hot outside. So yeah, I would probably say you want to start, well, I would start at about maybe 185 over 10 there and then go up by maybe 5% each treatment.
Mm. And could they use like something to cool the skin down before they start with the treatment? Would that make it easier or?
Um, I mean, if you wanted to have the patient put like a cold mask or an ice mask on beforehand, but the problem with that is you don't want there to be any dampness in the tissue. So
No.
it would just depend on what you use to cool the skin. But like I said, I have little handheld fans. You can get them on Amazon or at John Lewis or at any sort of department store that are about 15 pounds each. And they're just handheld. And I have the patient hold them and it
Mm.
cools the skin down really nicely. And it also seems to like, because so many things are happening, the body doesn't really register the discomfort because you've got a fan blowing on you, you've got a handpiece moving around on you, you've got me talking to you. So I find that the fans, they also give them something to do.
Yeah.
So the fans really help. And they aren't, it's not like a little fan you would get at a run or a 5K or something. They're nice little fans. So patients really like
Yeah,
that.
that's a really good idea. And then last question from Roy. Do you recommend demo treatments to clients and which treatment will see the fast results? The
So demo
fastest results.
treatments, if I was going to do a treatment just to show a patient the result with the nanofractional, I would probably treat the neck at like 180 over 5 so they can quickly see, because then in about a week you'd see a difference. But as far
Mm.
as demo treatments, I wouldn't use the Viva nanofractional for a demo treatment. I would use the multipolar because you see a big difference in the tissue within 15 minutes. So but no,
Yeah.
I don't recommend a demo with the Viva. It would be a little bit difficult because you are pink straight away after and there's some discomfort.
Okay. I think we've got one last question.
Yeah.
And Adrian's asking, what are the recommended settings or protocol for melasma and rosacea?
So I treat at 180/5 for my first melasma and my first rosacea treatment. If I am treating any other indication, so if they're rosacea and they have very obvious pores, I will bump that energy up to 10, the millisecond up to 10, but I will leave the voltage at 180. With rosacea and melasma, you're not trying to generate a lot of heat or ablation. You're trying to stimulate new healthy tissue. And remember, the body will push out those damaged cells on its own if you give it the right tools to do so. So by treating at 180/5, and then for the second treatment, bumping up to 180/10, I keep them on that setting for 3 treatments. So that's 3 months basically, because I treat every 3 to 4 weeks, depending on the patient, and up to 6 weeks. So yeah, that's and then let's say let's say the woman comes in and she's 60 years old and she has rosacea. She's going to see a huge improvement in her rosacea from those first 3 treatments. And then you can treat the wrinkles and rhytides and enlarged pores.
Okay, amazing. I think that's all the questions. We don't have any other questions, so I think that's it. If anybody else has got any, can you raise your hand now and I can ask them? Oh, and Liliana's just asking one last. Would you suggest the same for scars?
For scars, no. For scars, you always want to start a little bit higher. So my first treatment for scars, I would start at 225/15 for their very first treatment. So 225 is the voltage and 15 is the millisecond. And then I normally go up by 10% each treatment. But again, that depends on the patient. So let's say they have rosacea and heavy scarring, you would want to start lower. Or if they had melasma and heavy scarring, or if they have heavy scarring and fine lines and wrinkles, you may want to do 2 or 3 treatments. But if they only had scarring and that's all they were presenting with, then I would start with 225/15 and then raise it 10% each treatment.
Okay, amazing. Well, that's all the questions. I don't think anybody else has got any more. So I'd just like to say thank you to everybody for attending. Thank you to Renee as well. And I don't think if anybody else has got any questions, I think we can end the webinar there. Thanks so much, everybody.
Thank you.
Thanks, Renee.
Thank you.
Bye-bye.
Bye-bye.
Bye.